Next slide. We have a full agenda for you today. We'll start with a welcome and overview. We'll provide an overview of Trillium's tailored plan. Then we'll have representation from our Trillium's claim staff about behavioral health claim trends and denials. And then we'll hear from our standard plan partner, Carolina Complete Health, about some physical health claims trends and denials. We'll have a presentation about personal care services with some examples. We'll talk about adding and removing services from your contract, resources, and then we'll have a time at the end for Q&A. Again, welcome to our first provider forum for 2025. My name is Linda Hawley Isbell. I'm the Associate Vice President of Provider Relations and Engagement and the Provider Support Services. Just to share a little bit about Trillium Health Resources, we are a tailored plan and managed care organization that manages serious mental health, substance use, traumatic brain injury, and intellectual and developmental disabilities in North Carolina. This is for individuals receiving Medicaid through the tailored plan, and we cover physical health care and pharmacy services as well. We also assist uninsured individuals through state-funded services. We cover 46 counties for Trillium Health Resources, and you see the land mass here, our total population, and we serve 30% of the total population. We currently have 54,105 physical health providers in our network. We have 14,103 behavioral health providers, 452 vision providers, 2,788 pharmacy and medical supply partners, and all of these providers participate in some or all of our counties. So all of our 100 counties are served through the providers in our network, and we're glad to have each of you with us today. So a little bit of housekeeping. We're going to be using the Q&A, question and answer, rather than the chat box for this session. So you can see that, and I'll show you in another slide where that is. So during the meeting, we will have subject matter experts, or SMEs, for the topics that we're presenting on today, who will be available to answer questions in the chat during the meeting. You can submit your question by using the Q&A button. If there are questions that require more research or of topics that we do not have SMEs on for today, we will take those back and provide a response in the frequently asked question document that will be posted on our website. Here you can see the chat bubble, but we will not be using that one today. We will be using the Q&A button on your screen. So please go to the Q&A button and we will provide answers to your questions. So I wanted to share a little bit about how we came up with the topics for today's meeting. During the late fall of last year, we conducted a survey for our provider network. We sent out the survey link in our network communication bulletins, and we posted it on our website to collect data on the topics that you as our provider network would like to receive technical assistance and education on. And you can see on the screen the top 7 topics that we had. So we're going to be covering those first 4 today. And then the next ones, along with other topics, we'll cover in our March meeting. When we did the survey, we also left a write-in box where providers could include other topics that they would like for us to provide education and technical assistance on. And so we'll be including those topics as well, and any other hot topics that come up during the month. And we want to thank you for your participation in that survey. It really helped us to know what the #1 topics are that are on your mind and that we can assist with for our provider network. I'm going to turn it over now to Chauncey Dameron and Kimberly Wagner.
Thanks, Linda. My name is Chauncey Dameron. I'm Provider Relations and Engagement Manager here at Trillium, and I'm just going to do an overview of tailored plan partnerships and the provider resources that are available. This is a diagram of some of the tailored plan partnerships that we have. Of course, we're going to start with Carolina Complete Health, Motive Care, of course, you all, the provider network, Perform RX, Centene Vision Services, and North Carolina State Department of Health and Human Services. These tailored plan partners, first to begin with Carolina Complete Health, is Trillium's standard plan partner, and they're responsible for our physical health network, including primary care, specialty care, durable medical equipment, vision, long-term services and supports, non-emergency medical transportation, and non-emergency ambulance transportation. Centene Vision Services is Trillium's vision partner, which is formally involved through our agreement with CCH, responsible for our optometry network. Perform RX is Trillium's pharmacy benefit manager partner, and they're responsible for our pharmacy network. Motive Care is Trillium's NEMT partner, and through our agreement with CCH, responsible for the NEMT network. And then last we have North Carolina Department of Health and Human Services, which is Trillium's oversight entity, and they're responsible for managing delivery of health and human related services for all of North Carolinians. Some resources that we have for you. All behavioral health contracted providers are assigned a provider relations and engagement coordinator as your first point of contact for any questions. And then you will be able to find those who's assigned to your agency if you are a behavioral health contracted provider on the website. Their email address is listed by their name, and you can just simply send them an email. If you prefer to contact Trillium by phone, you can call the Provider Support Service Line. We refer to it as the PSSL, and you can contact them at the number on the screen, 855-250-1539, and that is open, available Monday through Saturday from 7 a.m. through 6 p.m., including federal holidays. You also can email provider relations and engagement at the email address on the screen, and then you can review the Trillium Health Resources website as well at that web address listed. I'm going to turn it over to Jacqueline Thomas.
Thank you, Chauncey. Good morning, everyone. My name is Jacqueline Thomas, and I'm one of the claims supervisors here at Trillium. I'm going to be speaking with you today regarding claim denials. We're going to look at some of our top denial reasons and also steps on how to resolve those. Next slide, please. So the first code we're going to look at is number 62, which is service not authorized. Steps that you would take to resolve this would be to first check to make sure that you do have a current authorization for the member for the service. If you do find a discrepancy, you will need to send an email to our utilization management department, and that email address is um@trilliumnc.org. We also have some additional resources available to you if you should encounter this particular denial code on number 62. We have a very useful tool available on our main website, and we do have the link here available for you. You simply go to our website. You plug in your service code and it will let you know if you need an authorization for that particular service. We do have a link here also to our benefit plans and also our service definitions as well. The next code we're going to look at is number 330, which is patient not enrolled on the date of service. Claims that fall outside of the member's eligibility effective dates will deny. We encourage our providers to check Provider Direct or NC Tracks to check their members' eligibility. We do have the link here for NC Tracks. In the Provider Direct portal, we have some wonderful trainings there that you can access. I did include one of them on the slide here. Client search, insurance, and target pops. That's a very useful training for our provider community. If you have questions regarding a member's enrollment or eligibility, you can contact our enrollment and eligibility department, and that email is enrollment and eligibility at trilliumnc.org. You may also experience this particular denial code if you are billing a service code that is not included for the member's eligibility type. An example of that would be, let's say if you bill a B3 service, however, the member has 1915I coverage. That would be an example of that. Next slide, please. The next denial code we're going to look at is number 765, duplicate claim. A duplicate claim means that the member already has an approved claim for the same service and date of service. So you will want to check your RA or your claim status report. You can find those items in Provider Direct by accessing the File Transfers tab, and you'll select View File Repository. And we do have a small picture here to kind of show you what that looks like once you're in Provider Direct. We do have the tab here or link to the Provider Direct portal. There are also some other resources that are available to you, and I have the links listed here that are available via our website. We have a remittance advice or RA companion guide. It is a wonderful tool that will walk you through how to review your RA. It explains the type keys and just all the information that you would need to thoroughly review your RA. We also have the replacement and voided claims process. That information is also available on our website, and there again, I do have the link here for that. The next denial code is number 1140. Reference claim has already been submitted. Multiple resubmissions are not allowed. The referenced claim number attempting to be replaced is not valid, or the claim number being replaced has already been replaced. So you cannot replace a claim more than once. If you do, you are going to encounter this denial code. And I will share another important tidbit as well. When you need to replace a claim, you must utilize the CI claim number. You cannot utilize the provider direct claim number. And to locate your CI claim number, that's going to be on your RA or 835, and you can also find that on your claim status report as well. Next slide, please. The next code we're going to look at is number 1018, claim received after billing period. Claims that are received after the required time frame will deny as specified in the provider's contract. Timely filing guidelines could vary between lines of business and funding sources. Under certain appropriate circumstances, you do have the option to request a time limit override for claims you have that did deny for timely filing. You would complete a claims request form that's on Trillium's website. We have the link here to do that. There's also instructions available via the website that are outlined with regard to submitting the claims request form. We do have some additional resources that you can consult regarding timely filing. We have a claims billing guide. The link is here. And we also have a prompt payment tip sheet available as well. Just some great resources for you to access. The next code we're going to look at, number 1271, billing provider, NPI, and billing 9-digit zip. And when you encounter this denial code, the billing provider NPI and the billing 9-digit zip code combination were not found in our system. And the steps to resolve this would be to first check NC Tracks to ensure that the NPI and address match to what you actually submitted on the claim. If the address in your contract does not match what's in NC Tracks, you would need to reach out to our contracts department, and they can certainly get that information updated for you. After confirmation of your update is received, you will have to rebill your claims. The next denial code we're going to look at, number 1377. Please submit to Carolina Complete Health for processing. And typically when you encounter that denial code, it's because a physical health claim has been submitted to the wrong processing system. We do have the link here for a wonderful resource, our tailored plan and Medicaid direct claims submission protocol. It is a very helpful document that will provide assistance with regard to routing claims to the appropriate processing system. Next slide, please. And lastly, for information or any questions that you have, if you need to inquire about specific claims for specific members, certain claim denials that you have questions about, please contact us via email at claimssupport@trilliumnc.org. When you send an email to that claim support email address, it will generate a ticket in our case ticket system, and someone from our claims relations team will be happy to assist you with whatever questions you have. And you are always welcome to contact the provider support services line at 1-855-250-1539. Thank you so much for being here today, and I'm going to turn it over to Miss Jessie.
Thanks, Jacqueline. Hi, good morning, everyone. My name is Jessie Harden, Director of Provider Communications with Carolina Complete Health, the physical health partner for Trillium Health Resources Tailored Plan. And we have a few slides prepared for you today to share information about the common claims trends we're seeing in the physical health space, some general pointers, and then also an update and some great reminders for our personal care services providers. Next slide, please. Thank you. So first up, we're going to look at the top 5 claim denial trends that we've seen recently for our physical health providers within Trillium. So I'll walk through each of these and provide some guidance and point you towards some resources that are helpful to resolve these denials or prevent them. So the first one would be a denial for service facility NPI not on the Medicaid file or not active on the service dates. So typically the guidance here is to make sure that your provider data is active with credentialing in NC Tracks and that data on the claim matches exactly what is in NC Tracks. And the importance there is because the health plan receives the provider credentialing data from the state of Medicaid, North Carolina Medicaid, and so the information on the claim is validated against what that provider credentialing data identifies. Now with this, I will also say that this is now populated on the known issues tracker as of last week. So in some cases, you may have received this denial, and if it is in line with what is on that known issues tracker, then you probably do not have to take any action. We did identify this as a known issue, and you can use that weekly known issues tracker to track the progress of that issue, and that is updated weekly. And you can find that known issues tracker in 2 places. We do maintain it at Carolina Complete Health Network, and that will be a known issues tracker that encompasses our Medicaid lines of business, including Trillium Physical Health. And Trillium Health Resources also maintains their provider known issues tracker, which includes their medical and behavioral health known issues. So 2 places to find that known issues tracker. But more than likely, if you saw this denial recently, you likely do not have to take any action, and CCH is in process of resolving that. Next on the list, we have service or service modifier combo not found on the fee schedule. For this, we want to gear you towards the state Medicaid fee schedules, and that is a great website where you can now type in the service code that you're looking to check, and it will validate whether it is a covered service for North Carolina Medicaid and also list the appropriate modifier combos. And again, that is a state website that we adhere to because we do utilize the state fee schedule for physical health claim processing. Third common claim denial is bill primary insurer first. And so this is when there is a primary payer, and we always recommend prior to submitting the claim, verify that member's eligibility once again, and that way you can see if there is a primary payer, since federal regulations do require Medicaid to be that payer of last resort. So you would bill the primary payer, and then once you receive that explanation of payment from the primary payer, then you can submit that claim through the Trillium physical health claim submission methods for Medicaid Trillium physical health to process that claim. Also, as a Trillium physical health provider, you've got access to the physical health portal, which we'll talk a little bit about today. And we do have a provider guide on exactly how to submit a coordination of benefits claim using the portal. Next is a denial for the billing NPI plus taxonomy not on the Medicaid file or not active on service dates. So this goes along with what I shared earlier. If you ever see any denial about the NPI or taxonomy not being on the Medicaid file or not active on service dates, that is a cue to verify that your provider data has active credentialing status with NC Tracks and that what was put on the claim matches exactly what is in NC Tracks. Now, somewhat related, but I did want to take the opportunity to point out taxonomy, since missing rendering and or missing billing taxonomy is a common cause of claims processing delays and denials. So that is when the taxonomy was not included on the claim. And this is just a reminder to include that, and again, that it should align with what your provider data has in NC tracks. And we do have a provider guide for taxonomy placement as well. Lastly is a denial for a duplicate claim service. So when a claim is submitted, the adjudication process is going to evaluate that claim across across other claims to ensure that there is not a previously submitted claim for the same member on the same date with the same provider. This also does look across providers as well to see if there was another provider that was paid for the same procedure for the same member on the same date of service. So we do have some guidance for avoiding that duplicate claim submission. Sometimes this also may happen, say if you did get a denial that a claim that you submitted was missing taxonomy. Instead of submitting the claim a second time with that taxonomy filled in, if you did it that way, it would deny for duplicate claim service. What we recommend is going to that original claim on the Secure Provider portal, and you can actually correct the claim right from that screen. And that's going to resubmit that same claim for processing. Next slide, please. So we've received a lot of questions recently around physical health versus behavioral health billing. And so just wanted to point you towards some great resources here, both from the state as well as Trillium. Back in November, the state did update their health plan billing guidance with some clarity around what outlined behavioral health versus physical health. And you can find the latest health plan billing guidance on the state's website. We've linked it here. But generally speaking, claims with a primary care billing or rendering provider taxonomy are considered physical health. You can also find details about this with a really helpful decision tree on Trillium's claim submission protocol linked here. Now, along this time frame, we also noticed an issue where our primary care and physical health providers were receiving denials for a couple of screening codes that you see here, and these are commonly used in primary care and pediatrics to screen members for anxiety and depression. And that was also on the known issues tracker. So we'll skip to the next slide to highlight this known issue that was placed on the tracker as of January 30th, and you can track the progress of this issue week to week as that issues tracker gets updated. But this is now in process to be resolved. So if you incorrectly received this denial as a physical health provider, and that denial said that you should have billed Trillium for this code, you don't need to take action at this time. Those claims will be reprocessed. And as always, we do encourage our physical health primary care providers to continue screening members for those behavioral health conditions. And of course, that's promoting whole person integrated care. Next slide, please. So also wanted to share with you some guidance around the general process for how to correct a claim and how to dispute a claim. So I spoke to claim corrections briefly, but I'll outline that a little bit more here. That's the first row that you see on this chart here. And generally speaking, this is for claims that you want to make a correction to the initial claim submission. So instead of submitting another claim with the same information and that denying for duplicate, you can actually go back to that original claim and correct anything that is invalid or incorrect. And you do have 365 calendar days from the date of service to file a timely corrected claim. The most efficient way to do that is through the Secure Provider portal, and you would view the claim details and then select correct claim. The next two rows are part of the claim dispute process. There's two levels to the claim dispute process, and it starts with level 1, which is called a claim reconsideration. So this is when you submit a claim and it's adjudicated and you would like to dispute how that claim was processed. You would start with the claim reconsideration. You have 365 calendar days from the time you get that, from the date, excuse me, of that explanation of payment or or remittance advice to submit a claim reconsideration. And the most efficient way to do this is through the secure physical health provider portal. You would log in, search for that claim number, then you can click on the claim details, select dispute, and hit reconsideration. Once that claim is reconsidered, you will receive an updated reconsidered explanation of payment. Oh, you can go back to the, thank you, a reconsidered EOP or ERA. If you would like to continue to dispute that claim after you receive that updated explanation of payment, you have 30 calendar days from that date to do so. And that is what we call a claim grievance. You do have to go through a claim reconsideration before you can proceed to a claim grievance. And this is a very similar process. You would go to that claim detail, hit dispute, and then submit that claim grievance. There are paper methods for all of these processes, which we also outline here. And if you have any questions about this, you can reach out to Provider Relations or Engagement, and we'll share some contact information with you in the next few slides. Next slide, please. So now we'll talk a little bit about personal care services for some helpful reminders and some updates that are coming up in the next couple of months. So next slide, first we'll talk about how to initiate personal care services. So you're probably familiar with the 3051 form. This is a pretty standard form that providers submit to request personal care services. Trillium maintains a 3051 form for Trillium Tailored Plan members, and this should be submitted by the member's primary care provider and emailed to Trillium using the address listed here. That member's primary care provider should also submit that 3051 on an annual basis. And if there is a change of condition, the medical provider should also issue a new 3051 form. An important reminder here is regarding the reauthorization of personal care services, providers do not need to request the reauthorization, and this is because these members are supported closely by LTSS care managers who are regularly assessing these members, and they will work directly with the utilization management team to build new authorizations when medically necessary. Next slide, we'll talk a little bit about billing for personal care services. So personal care services that are rendered in the home with the HA or HB modifier, those are the ones that are subject to the EVV, electronic visit verification requirements. And that is due to a federal requirement around utilizing EVV for these types of services. Trillium partners with HHA Exchange as the EVV vendor, and we've linked their website here for more information about how to get connected with them if you're not already. There are other PCS services that are billed with various modifiers. You can go back, please. And for example, this could be congregate care setting, personal care services, for instance, and these would be billed through the Trillium Physical Health portal if they're part of that physical health member benefit. And then lastly, we do have a provider website that we maintain for our physical health PCS providers, and that will encompass some great resources and updates for you. Next slide. So I'm going to spend a little bit of time talking through how to register for the portal and how to view some key components of the member's health record that I think will help not only our PCS providers, but physical health providers broadly. So let's start with how to create a new account in the Trillium Physical Health portal. The web address is listed at the top of the slide, provider.trilliumhealthresources.org. If you haven't yet, please create an account. The first thing it'll have you do is enter your email address, and then it's going to generate an email to that address so that you can verify that email. So a tip here, since sometimes emails like this may be filtered to spam, is to look for the entry key ID email address, and we even recommend going as far as adding that to your email contacts to ensure you get that email verification. Next slide. So once you've verified your email address, you'll come back to the portal login screen and enter that email address. Then it'll prompt you to plug in your tax ID number, business phone, and fax. The tax ID number is key because the portal is driven by tax ID number, and that is for our contracted providers. We do recommend that each organization have an account manager established for your site to support adding and removing users to the secure physical health portal. So if you already have an account manager set up at your site, that person can actually verify your access. If you do not, we can help get you set up with that through our provider engagement team. Next slide, please. So this here is an overview of the process. You'll get a copy of these slides, so you'll be able to look back and reference this. But generally, you're going to be creating the account, verifying your email address, going ahead and logging in to enter your tax ID number. That will kick off the last verification step, and that can be verified by your account manager, or if there is not an account manager set up yet, through our provider engagement team. Once you're fully activated and verified, that's when you'll have full functionality of the portal. Next slide, please. So once you have full functionality in the portal, we recommend using this to look up members that you're serving, look up your members, and you can actually view some great information in their health record. But first, the way to look up a member, right on the home screen of the portal, you can search for members using first their ID number, their Medicaid ID, or their last name. Either or for that first field, and then date of birth is also required. And then in the drop-down menu, you'll select View Eligibility and Patient Information. Once you submit that, it'll bring you to a screen, and it should indicate that that member is eligible if they in fact are an active tailored plan member with Trillium. And then on the next slide, please, we can take a look at what you'll see when you click that member's name. So it'll bring you into the member's health record. And there's a lot of good information right on the front of this in the overview, but I'll direct your eyes to the left side. You've got several different tabs on the left side menu. When you click Assessments, next slide, please, it will bring you to a screen where under the right side, under previous assessments, it will have any assessments that were completed by the care management team. So in the case of our PCS providers, this is where you will see assessments associated with long-term services and supports. When you click the assessment name, it'll open up the details of that assessment. Next slide, please. So the other tab I wanted to demo here for you today was the authorizations tab, which is what we're seeing here. So again, this is within the member's health record. You would click authorizations on the left-hand side. And what it'll do is at a quick glance, show you the current authorizations. The portal displays the authorization history for the last 18 months. Now we haven't been live as a TP for 18 months yet, but in the future it will store up to 18 months of authorization history across providers, which is really helpful. For any of these authorizations that you see here, as you can see from our example, it does give you the date range for that authorization. And if you click on the auth number, it will bring you into a screen to view more information about that auth. So I wanted to highlight those features in the portal since we do have frequently asked questions from our PCS providers around how to view the member information in the portal. And so I hope that was helpful for you. Next slide, please. So to wrap this section up for PCS services, I also wanted to take the opportunity and remind our PCS providers in congregate settings that we are moving to a per diem rate change in alignment with NC Medicaid. We sent some communications out on this at the end of January, but this is effective April 1st, 2025. The impacted providers here are for personal care services for beneficiaries in congregate settings. And so you see the various types here according to the different modifiers. So only procedure code 99509 with the modifiers listed here will be impacted by this change. Next slide, please. So what this means for you, if you are billing 99509 with any of those modifiers listed on the previous screen, come April 1st, instead of billing multiple units per day as you do currently, you will bill 1 unit per day. Also important to note that 1 claim line equals 1 day of service, but you can include a full month of claim lines on a single claim. So I wanted to point that out because it is important to note that after April 1st, a claim line that spans multiple dates or includes a unit greater than 1 will deny. If you have any questions on this, please don't hesitate to ask. Again, this is in alignment with NC Medicaid, and for our providers billing these codes, this code with those modifiers, this will be a change in really the way that you bill in terms of the unit is going to mean a single day, and a line equals 1 day on that claim. Next slide, please. Great. So to wrap this portion up, we'll share some important contact information for you. So all providers have multiple points of contact, but we wanted to highlight some of these teams here. So for our physical health providers, you are supported by the provider relations team at Carolina Complete Health Network, the physical health partner for Trillium. And for instance, if you have a question about your contract status, you can reach out to that team, and that's network relations at cch-network.com. All of our physical health providers are also assigned a provider engagement administrator through Carolina Complete Health Network. These folks are able to support you really hands-on with education and orientation. So a big one here is if you have questions about the secure physical health portal, you can get some one-on-one support and education for that from your provider engagement team. If you have questions, for instance, about how to enroll with our electronic funds transfer partner, PaySpan, they can help you with that as well. So I did link the team's page here. On that page, you'll find their names and the counties that they serve. If you have any questions around who to reach out to, by all means, don't hesitate to just reach out to the provider engagement team, and they'll be sure to connect you with the correct person. And then lastly, the behavioral health providers, part of the Trillium Tailored Plan Network. You are also supported by the Trillium Provider Relations and Engagement Team for all questions that you have, and you see their contact email and the provider support service line listed here. Next slide. Thank you, and I'll pass it over to Richard next.
Thank you so much. I appreciate it. How's it going, everybody? My name is Richard Uranga, and I am a network development coordinator here at Trillium Health Resources. I also serve as the veteran point of contact. And today we are going to be going over how to add and remove services from your contract. Next slide, please. So beginning with the adding the service, we're going to go through the steps of verifying that the information is correct, then the steps on actually submitting your request. Once we're done discussing adding a service, we'll move on to how to remove a service, and then there'll be time at the end of this presentation for questions. Next slide, please. So in order to add a service, the very first thing that needs to happen is the provider would need to verify that the information is correct in NC tracks. Trillium gathers information from NC tracks through something called the provider enrollment file. So that information has to be updated in NC tracks, then it gets fed into Trillium using that provider enrollment file. And then that's how Trillium can verify that the site is set up correctly and available to use. So when you're setting up for NC tracks, the things that you're going to want to look at is that the service location is active and it's using the correct tax ID, NPI, and taxonomies for the service that is being requested. The service address needs to be listed as service location 3 or higher. Provider would need to make sure that the Medicaid benefit plan is active. And if applicable, depending on the service, the provider would need to verify that the licensing and accreditation is also active and reflecting in NC tracks. So some services that may require a license would be substance abuse, intensive outpatient, residential services, anything where the CCP clinical coverage policy states that a license is needed. That license would need to be reflecting in NC tracks for that site. And then some services that may need accreditation, that also needs to be reflected in NC tracks. Some services that may need accreditation are like 1959 set of services. You have to be nationally accredited to provide a lot of those services. And then finally, you would need to make sure if the service requires a rendering practitioner, that rendering practitioner would also need to be enrolled in NC tracks individually. And then they must also be affiliated from their individual NPI to the NPI and address of the service. So for example, some services that may need a rendering practitioner are services that utilize a specific licensed practitioner. So if you're doing some kind of like evaluation and management services, you might need a MD to perform those. Or if you're doing intensive in-home, you might need a licensed clinical social worker to be the team lead. So any of those services is where you would want to make sure that not only is the site set up correctly, but the practitioner that's going to be rendering those services is also set up correctly. Next slide, please. So once you've verified that all of this is set up, the site's correct, you have your licensing accreditation, the rendering practitioners are set up. Once all of that's done, the next step would be to notify Trillium of the request. And to notify, you're going to email NetworkServicesSupport at trilliumnc.org. When you're submitting that email request, you're going to want to make sure that the organization information is on the request. So the name of the organization, the tax ID, NPI, the billing address, service address. Then you're going to need the service details. So the service name and the CPT codes that are related to that service. If you need assistance locating the CPT codes, you can go to the Trillium Health Resources website. Under for providers, we have our benefits plan listed. We have our rates table listed, and then we have links to clinical coverage policies. So any of those you'd be able to look at and find the CPT codes related to the service that you're requesting to add. And if you have a specific member that you are requesting to provide services for, then using a secure email only, make sure it's secure, so we're following HIPAA, but you're going to submit that member's name, date of birth, and Medicaid number. And with all that information emailed to Network Services Support, as long as you did the verification process at first, once Trillium gets it, everything should be set up a lot easier and it'll make the process go through a lot quicker. Next slide, please. Removing a service is a pretty simple, straightforward request. On the Trillium Health Resource website, click for providers, click on documents and forms. There we have a provider change form that is up there. Download that form, complete it. There's a self-explanatory sections just asking what are you requesting to add, what are you requesting to change. Once you fill that out, submit it to the same email, NetworkServicesSupport@trilliumnc.org, and that would initiate the process of removing the service. And that is all I have. Thank you.
Good morning, everyone. My name is Kimberly Wagner. I'm also one of the provider relations and engagement managers. Just to go over a few of the resources again, some of it may be a repeat, but we have had some really good feedback and questions in the Q&A. So if you could go on to the next slide, please. Our upcoming provider forums, as many of you are aware, this was our first forum, so we appreciate your patience as we navigate through this first one. Upcoming forums will be on the second Wednesday of each month, 10 a.m. to 12 p.m., and they will all be virtual. So our next one will be on March 12th, again from 10 a.m. to 12 p.m. Next slide, please. And to register for that forum, you can visit our website, trilliumhealthresources.org, and under the events section, there will be a way that you can filter for the events by selecting the month and then applying that, and you'll see the provider forum for March 12th. If you'll click that, you'll be able to register for that, and it will be something that you would need to do for each forum. The registrations will be separate. Next slide, please. Okay, and then just a repeat of the resources that we provided earlier for the provider support service line. That line is available 7 a.m. until 6 p.m. as well as holiday hours. That line is available for providers to call that number for questions regarding behavioral health and physical health questions. The member and recipient service line is available Monday through Saturday, 7 a.m. until 6 p.m., holidays as well. And then, as Chauncey mentioned earlier, you may email provider relations and engagement at NetworkServicesSupport@trilliumnc.org. And then the website is available at all times as well. There is a for providers page that will give you specific information, and I did want to call attention to the communications section under resources. If you would like to sign up to receive our network communication, clinical bulletins, and urgent bulletins, you can select communications under the resources section of our website and put in your information, and you'll be added to that distribution list. Next slide, please. All right, at this time, if there are any other additional questions that are not yet in the Q&A, you can either add them to the Q&A at this time, or you can use the raise hand icon at the bottom of this screen and raise your hand, and we will work with you on trying to address your questions. Those questions that have not yet been answered in the chat, please know that we will get a subject matter expert to reach out to you with feedback. We'll also provide this Q&A on our website once we have posted the recording of this forum. Jonathan, I don't see any raised hands. Do you?
I do. I don't know how to. Let me try.
Let's see. And I'm not able to see them, so I'm not sure why.
Jonathan, while you're checking that, just a reminder, I know Kim and Chauncey have answered some questions in the chat about the slide deck. I just saw another one. We will be posting the recording and the slide deck on our website, and we will send out a network communication bulletin to let you know where they will be located. And then we'll include that information in each of the provider forums so you can easily find those.
Alrighty, I have 1, 2, 3, 5 individuals, so I'll just call out your name. Just know you'll get a request for unmuting, and you can go ahead and ask your question. So first up, I have Donna Roberts. So I'm going to go ahead and unmute you.
I had put a statement out about there's been a lot of communication in the chat, specifically about innovations, TARS, and that this is a very different process for Trillium than any other tailored plan. And for members that came out through East Point and Sand Hills, like there really wasn't a lot of information provided to us on how this process is working. I've had to reach out to and I don't understand, they're giving stuff back to us, but we're not the care managers, and the care managers don't see this. And there just seems to be some missing direction to the providers and care managers that came from East Point and Sand Hills on how the TARs and authorizations and care plans and everything are working for innovations. Wanting to know, I see a lot of, hey, give me your name and number, we'll get someone in contact with you. But this is a trend and this is across the board. So how can we get this resolved?
Right, and we appreciate those questions. We do not have, it wasn't a topic for today's forum. It will be in the future, but meanwhile, we will do our best to get answers to you guys. That's one of the reasons why we were asking for individual information. There is the website, at trilliumnc.org. If you have done that, or you're not getting the answers that you need, you can certainly try either the provider support service line or email Network Services Support, and we will help you navigate through that.
Donna, what is the name of your agency?
United Support Services.
Say that one more time.
United Support Services.
Okay, thank you.
Yeah. So
I'm gonna have someone reach out to you.
thanks, Chauncey.
And just as a reminder, we do have a coordinator assigned to all of the behavioral health providers, and Chauncey oversees that part of our unit and network management. So they are a great resource to you. And we appreciate all of your questions today. And as Kim said, we do not have, and I said at the beginning, we don't have a subject matter expert for every question, but your feedback is really good. We want to make sure to resolve your issues, help you determine how to resolve them going forward. And then also, if it looks like there's a trend in the Q&A chat and in our questions today, we can bring that to our next meeting in March. Back to you, Jonathan.
Alrighty. Next up, and apologies if I mess up your name to this morning. But next up we have Alicia Tatum. So go ahead and going to unmute you.
Tatum from Lifespan. This is a follow-up question to the issue with the innovations TARS, and I understand you don't have a subject matter expert and you'd like to kind of give us those answers at the meeting next month. I just want to make sure that that everyone at Trillium is very clear about the urgency of the TAR situation for innovations and how the rollout of the changes has disrupted services. And it's also caused a great administrative burden to providers as we are having to frantically put in TARs, but we don't have the required information in order to align with the benefit plan that Trillium has posted. And so my overall concern is that our transition from Sand Hills to Trillium has been riddled with issues regarding billing, claims, contracts being loaded correctly. And as a result, providers have to suffer financially in order to continue to serve our folks. So if you can take anything back from this provider group, as you go back to your respective departments, this has to be something that's addressed and addressed very quickly in order for us to do business well for the people that we support. And if there is any way that I can get the attention of someone in your department to assist me with a myriad of concerns that we have already submitted for resolution, I would so appreciate it. And thank you so much for your time. I know you guys didn't expect all of the energy today, but please know this is a very important issue for providers.
Alicia, and thank you. One of the reasons we're having these meetings is to find out what the issues are that we can provide technical assistance and education on. And if you want to put your information in the chat, Chauncey can also have the coordinator that is assigned to your agency reach out to you and assist you with that. And when I said we'll provide some information in the next meeting. We definitely understand that this is an urgent issue for you. So we'll have someone follow up with you in the meantime, but we can provide some other technical assistance in the next meeting. But we're not going to ask you to wait until then. We'll definitely have someone follow up with you. Back to you, Richard.
Next up, we have Mashunda Famble.
I wanted to, which there have been a couple of people before me that kind of have addressed the issue as far as the TARs. However, I think that the biggest issue that I am seeing on my end is, and it has also been kind of briefly touched on in the chat, it's the T2012, T2012 GC, and T2013 TF. At Sand Hills previously, we had an all service code, right? And with that all service code, all of the hours were put there. And then you still had to go through the protocol of RADSI. And then you would say, okay, if it was build community, or then you use your EVV system to do that. However, the way that it is set up on the TARs, it is creating a lot of obstacles, because if the care manager did not list it in the plan correctly and they listed it as T2012, and that's what the authorization or the TAR has to say, and they are getting services in the home because something changed in the community, it is not easy to shift those hours back and forth. So then you have to do a plan update. Or if the parent is sick and we have to call in backup staff to run goals, and they are supposed to have 40 hours a week. So we have to kind of get to some type of consensus of how we're going to address the TAR for that community living and supports, because our members' lives are very fluid. And so we have to be fluid with them. However, the way that it's set up as far as with the TAR, we don't have that level of flexibility at all.
This is Linda again. Thank you for sharing that information. We'll definitely take this back and share that with our UM department and get some information back out to you all. But thank you very much for sharing that.
And another thing, because it was very clear in the bulletin communication that whatever the TAR says is like the service order, right? And so the longer it takes for the care managers to get to the plan, to update, to shift those services, well, then we can't build the appropriate service. So, and then no back billing or back authorizations are going to be honored according to the communication. So I'm really concerned about how we're going to remedy that, because we are already, 12 days into this, which means the provider itself will lose 12 days of pay before we can remedy the issue. And then the second thing is, I was looking over a packet that was from Trillium, and it was some of the handouts that the TCM gives families. And on that form, it says that the budget is $135,000. And the annual budget is supposed to be $184,000. And they're required to sign this to submit. So they may want to go back. It looks like the form hasn't been updated since June of 2018. And because they're signing it, it's kind of like, from a legal standpoint, it's kind of locking them into that. And so I think that we might need to go back to the care managers to let them know that the budget was increased. And a couple of parents said they received letters. So I wanted to make sure that someone was aware of the issue, that the budget reflects incorrectly on the paperwork, unless we're getting ready to get another surprise.
Again, thank you very much for sharing that information. We will take that back. But I appreciate you sharing your concerns. Again, one of the reasons we're having this meeting is to provide education and technical assistance and answer your questions. And we can't answer it right now because we do not have those SMEs on the line, but we'll definitely take it back and someone will follow up with you.
Okay, perfect.
And I'm gonna send it back to Jonathan. Sorry, Jonathan, I called you by the incorrect name before.
Completely fine. A lot of people on the call. So let me see. Um, if individuals who have asked questions, I want to make sure if you have a follow-up question, we do get around to it. But if you're good, if you could lower your hand, I guess, just to make sure that I know your answers are getting properly addressed. So appreciate that. Um, Next up, we have Latravi. Go ahead and unmute you.
So I really we're kind of new to Trillium. How do we know, or how do we find out who our care coordinator is for the agency?
You want to share about the coordinator assignments?
Is that you're talking about who's assigned to your agency as a whole, or a care manager for your members? Which one?
For the agency as a whole.
Oh, okay. You can go to the website for Trillium.
Uh-huh.
If you go under the For Providers heading, and then
Okay.
you'll scroll over to provider information, and then you'll see it says contact information and provider portals, and you'll scroll all the way down, and it's a big highlighted box that says provider relations and engagement coordinators for behavioral health providers, and you'll just click on that and you'll search for your agency's name, and
Mm-hmm.
you'll see an email address and a contact person there.
Okay. Thank you so much.
You're welcome.
All right, next up we have Karen Peters.
I'm with the Bethany House in Southern Pines. Everybody's addressed the tar issues that I was going to ask, but I have one additional issue. We were designated as physical health for a couple of months. We couldn't figure out the responses to the TARs or anything else and what they were asking us to do. And it was because we were the requirements are different for physical than they are for mental health. And now that they've finally designated us correctly, we're still not able to backdate claims because we've lost at least 4 months of claims and we're getting into an extreme financial hardship. This has to get addressed. Thank you.
Karen, I apologize. I did not catch the agency name.
The Bethany House Incorporated in Southern Moore County. We
All right.
were with Sandhills, and the only
Yes.
reason I found out that we were designated incorrectly is because I called a known friend that worked at Sandhills. We've been in existence since 1989. I have never had this issue with claims, never had them with Sandhills.
Okay. All right. Thank you for sharing that. We will get somebody to reach out to you.
Yeah,
Thank you.
if you want to put your information in the chat, or we can look up your number.
I'm on a phone and I forgot how to get to the chat.
That's okay. I've written it down. I'll look it up.
Okay. Sorry.
That's okay. Thank you.
Jonathan?
And next up, I have Raising a Standard. And just so you know, Alicia Tatum, Latravi, and Karen, I know you're on a phone. Actually, I think two of you are on a phone. See your hands are still raised. Okay, they're going down. Just want to make sure. So next we have Raising a Standard.
talking muted. Um, my question is, I'm new also, and I am trying to do a claim, which I do have an appointment this evening with someone. But as I was watching the video again this morning, it says I needed to contact MCO. Can you explain to me what that is? It says something about I'm not in the system.
Okay. Are you a behavioral health provider or a physical health provider?
Behavioral health.
Okay. Chauncey, do you want to let her know how she can find out who her coordinator is?
Yes, I'll put your coordinator's name in the. I guess I can. I don't have a chat, so put your email address in the chat if you can, and
Okay.
I'll have them reach out to you.
Alrighty, next up we have John Maddox. And just something I'm noticing, I think people are getting cut off when they're hitting unmute, and we're losing either their name or the agency they're with. So if people will give maybe like a 2 or 3 second delay, just so you're not getting cut off. But next up, John Maddox.
John Maddox from Vance Recovery. We are in Vance County, as you might guess. So we are having, and we're in an opioid treatment program, we're having a real problem with secondary insurance denials. What seems to be happening is there's some predatory policies being given to people, marketed to people. They get a phone call and says, hey, we're going to send you a $50 gift card or whatever it is. Is that okay? And then they sign up for this insurance, and we're in the spot where if we don't admit them, we're denying services to a vulnerable person. And if we do admit them, we've got several weeks of free service while we try to track down getting the documentation needed to cancel the policy. So one is I just want to educate people on these, tell your patients, make sure you know what you're saying yes to, and then see if there's a way that we can solve this problem with what I see as predatory policies blocking either payment or services. Thank you.
Thank you for sharing that information.
Don't see any new hands raised. I do see 3 from previous people who asked questions. If they'll use the Q&A or lower and raise their hand back up. Otherwise, no new questions at this time.
This is Linda. I did see a lot of questions about 1915I in the chat, and that is one of our topics for our March meeting. We will take back your specific questions, though, and respond to them in the document that we're going to post on our website. But I did want you to know we are going to have someone provide education and technical assistance about 1915I in the March Provider Forum.
Got one new hand raise. Abby, I'm going to go ahead and unmute you.
My agency is Mental Health Associates of the Triad, and we are also experiencing very long times for claims being paid. And we're in the same boat as a couple other agencies we've heard on here. And I may have missed the answer or the resolution to this, but what other than, we receive responses and requests for more information, providers licenses, and sending credentialed sheets and things of that sort when it becomes down to us responding and reaching out to get these claims paid. What is a way to initially send in those claims and not experience this every single time, because it is coming up more often than not, for these claims to be paid. And it seems like we are providing the same information over and over again, and it's just delaying that process even longer. And so that's my question. And then also to piggyback off of the care coordinator question, I went into that provider list and wasn't able to see us listed there. And with our new enhanced services, this would be something that we would need to utilize.
Abby?
Mm-hmm.
Hey, this is Jacqueline Thomas,
Hey.
one of the claims supervisors. Can you drop your contact information into the chat,
Yes, ma'am.
so that I can have someone from our claims relations team reach out to you, with regard to your claims that do not appear to be paying in a timely fashion.
Okay.
Thank you.
Yeah, of course. Thank you so much.
And Abby, to add to that, your agency is listed on the list. I would
Okay.
double check it. You're assigned to a Danita Myrick.
Danita Merrick. Okay,
Yes,
perfect. I will check.
it's in alphabetical order, so I try to make it easy as possible to find it. But it's quite a bit of providers up there, so
I see what you, I'm so sorry. So I'm apologize for that. I see it now. Oh, thank
it's
you.
okay.
All right. I think that was the end of my questions. So thank you.
Still have no new hand raises at this time. Oh, there we go. Oh, Mashunda. Oh, sorry. I just hit the. If you re-raise your hand, I hit the wrong button. Sorry about that. There we go. There's the unmute.
It's me again, friends. So, just for clarification purposes, how long do you feel like it will take us to get the authorization and see the community living and support issue resolved? And is Trillium going to consider or reconsider the hard stop tar date as it relates to those claims that need to be submitted? I just don't, I want to make sure I know what to anticipate.
As far as the TAR, we do not have anybody, any SMEs on from UM. I don't know if any of our claims SMEs can respond to that, or is that something we need for UM to respond to?
Unfortunately, I think UM is going to have to address those specific questions. I apologize.
Oh, no, that's okay because I can put in a help ticket. But thank you for letting me know that.
Thank you for your question. Thank you, Jacqueline.
Are there any other questions?
No new hand raise at the moment.
Okay. Okay, well, we'll go ahead and wrap up today's forum. We do want to sincerely say thank you for those of you who have asked questions and those of you who have attended, please share with your colleagues so they can also register for next month's forum. As Linda said, we're not going to wait, until next month to address these questions. We will make sure that the appropriate departments receive the questions. We'll also be posting the Q&A out as we post the recording of the forum and the slide deck. Excuse me. So thank you again for your time today. We appreciate it. Please know that your concerns matter to us, and we are focusing on customer service. We want to make it easier for you so that your work is not harder. We want to be able to provide you the resources that you need, and this is our first step at it with this first provider forum. So thank you for your patience and thank you for your feedback today. Everyone have a great afternoon.